Thank you for joining our Choice webinar. Throughout today's webinar, we'll be sharing valuable information about clinical trials and biomarker testing. And you'll hear from inspiring professionals who work at clinical trial sites and offer both biomarker testing and clinical trial consultations. Before we move into the educational components of this webinar, I want to share some highlights from the Choice 2025 community educational events. This past summer, we hosted Choice community events in Washington, D.C. and Los Angeles, California, in collaboration with community-based organizations. Together, we listened, learned, and participated in guided educational sessions and storytelling about the benefits of clinical trials. Each event combined education, storytelling, panel discussions, interactive wellness activities, and a community meal followed by an empowerment planning exercise. Tigerlily Angel advocates, breast cancer patients, survivors, previvors, and community members came together for a truly transformational experience. The outcomes of these powerful educational gatherings included opportunities to meet breast cancer clinicians and oncologists actively treating patients, to gain insight to the clinical trial enrollment process, and to learn about the critical role of biomarker testing. Most important, these events advanced our shared mission to expand access to treatments and improve health outcomes. Through Choice, Tigerlily Foundation achieved its goal of equipping the breast cancer community with the knowledge, education, and resources needed to participate in clinical trials, empowering each person to make informed decisions about their care and their future. Tigerlily Foundation's Choice Project is about providing women with just that, a choice that empowers her and one that could positively impact the trajectory of her care. What are clinical trials? Clinical trials test new treatments to ensure that they are safe and effective. Why do they matter? They help develop life-saving treatments, they provide patients access to innovative care, and they improve healthcare for all. There are two types of clinical trials we're going to focus on: observational trials and interventional trials. Observational trials are a cause and effect relationship. For example, does life experience impact health? And diagnostic studies, such as test new diagnostic methods versus the standard ones. And then there are interventional trials, which evaluate treatments and interventions. They're therapeutics, where they're comparing new versus existing treatments, and they're community-based research, where you're studying educational's impact on fair care. Why should you be represented in clinical trials? To ensure that treatments work and are safe for everyone, to create better healthcare solutions for everyone, so that you have access to cutting-edge therapies and new treatments not yet widely available. It's your right and your choice to be included. More treatment options are available for patients, and your participation helps researchers understand how different people respond to treatment. Phases of clinical trials: how new treatments are tested. Preclinical, phase 1, phase 2, phase 3, and phase 4 trials. There are preclinical trials where lab research tests if a treatment is safe and useful in cells and animals. In phase 1 trials, which usually includes 10 to 50 people, they are testing for the safety, tolerability, and drug interactions in healthy volunteers. In phase 2 trials, which typically has 25 to 300 patients, we are assessing the safety, tolerability, and short-term effectiveness in patients. In phase 3 trials, which typically has between 50 and 3,000 people, it is confirming treatment safety and effectiveness in larger populations. In phase 4 trials, which typically includes between 20 and 5,000 people, they are studying long-term safety, efficacy, and effects after market approval. Clinical trials, misconceptions, and the truth. Misconception: clinical trials aren't safe. Truth: trials follow strict safety protocols and are reviewed by ethics boards to protect patients. Misconception: clinical trials are expensive. Truth: most trials pay for study drug and care. Some also help with travel or lodging costs. Misconception: participation is too time consuming or inconvenient. Truth: many trials include flexible options like local labs, virtual visits, and fewer in person appointments. Misconception: I have no control over my care. Truth: you can leave the trial at any time. Participation is always voluntary and based on informed consent. Clinical trials have allowed me to better understand my disease and to be able to have more informed conversations with my care team. Being a part of clinical trials has empowered me to understand the science behind my disease and to understand how clinical trials can benefit me in the future. I think there's a common misconception that clinical trials are not safe. And I would say that's absolutely not true. Not only do you have your care team that's looking out for you and trial monitors and the regulatory boards that have approved these therapies for patients to try, you're also protected by the sponsor, and everyone in conjunction wants this drug to work well for you and they want to protect you. Patient participation in oncology trials is statistically very, very low, and we need as many people participating as possible. We need to understand how these drugs work, not only on people who look like me with my background, but how they work on people that look like you with your background. And the more that we are participating, the more we are figuring out what works on all of our different bodies, the longer people are going to live with this disease. What is a biomarker? A biomarker is a unique biological characteristic that helps us understand how the body is functioning. Think of it as a measurable sign that can indicate health changes. There are common biomarkers that you probably already know, such as body temperature. When it's high, you have a fever, or blood pressure. When it's high, you have hypertension, or blood sugar. When it's high, there's possible diabetes. So, how do biomarkers work in cancer care? Well, they can detect cancer early. They can help diagnose specific types of cancer. They can monitor treatment response, and they can help guide treatment. All in all, biomarkers really matter. When I was diagnosed 10 years ago, we looked at my biomarkers to determine what type of treatment I would need, because those biomarkers are known to have certain benefits to certain treatments. So I am HER2 positive, which is a biomarker, and then I am hormone receptor positive. And knowing that information is critical because it guides the treatment. And we know that the treatments that I was on statistically are the best for those specific biomarkers. So understanding your biomarkers is what is going to guide your treatment decisions. Know your cancer, why biomarker testing matters. Your hormone receptor status determines if cancer grows in response to hormones. Your HER2 status identifies HER2, positive or negative cancer types. PIK3CA mutation status detects genetic mutations affecting treatment. These are just a few of many important biomarkers. Each person's cancer is unique, and understanding your biomarkers can help guide the best care. Hormone receptor status and breast cancer. Some breast cancers grow when hormones like estrogen and progesterone bind to specific receptors on cancer cells, like a lock and key mechanism. Hormone receptor positive cancer, or HR positive cancer, has receptors and may respond to hormone therapy. HR negative, or hormone receptor negative cancer, lacks receptors and won't respond to hormone therapy. Biomarkers like HR status help personalize treatment plans. Understanding HER2 status in breast cancer. HER2 is a biomarker found in about 15 to 20% of breast cancer cases. It's a receptor on cancer cells that can fuel faster tumor growth. Understanding PIK3CA mutation in breast cancer. PIK3CA is a gene that controls cell growth. When mutations occur, it can lead to uncontrolled breast cancer cell growth. The PIK mutation status, which is PIK3CA mutation negative, or PIK3CA mutation positive. If negative, no mutations are detected. If positive, mutations are present, making tumors more aggressive. Why target the PIK3CA mutation? Targeting PIK mutations in breast cancer can lead to more effective cancer treatments, directly attacking cancer cells with fewer off-target effects. Personalizing care tailors treatments to the patient's specific cancer mutations. Overcoming resistance. It may help when standard therapies stop working. And safer options. Healthy cells are less affected, potentially reducing side effects. I have the PIK3CA mutation, and I've known about it for quite a while. I haven't needed to be on a therapy that specifically addresses it, but I know if all the therapies start to not work, that it will be an option. There are specific medications that are targeted to that mutation, and the hope is that because I have this mutation, that we can figure out a way to work around it so that we can outsmart my cancer.
Now that we've had a refresh on clinical trials and biomarker testing, we are going to hear from some professionals. First up is Dr. Amisha Talia.
My name is Amisha Talia. I'm a breast medical oncologist at MedStar Georgetown Cancer Institute at MedStar Washington Hospital Center. I started this position 8 years ago. My passion has always been breast cancer. I enjoy taking care of a female population. I enjoy being with them every step of the way. At our cancer center, we test all breast cancers for certain biomarkers, such as estrogen receptor or ER, progesterone receptor or PR, and HER2/neu. These tests help predict how the cancer might behave and respond to treatment. We also offer additional testing, such as genomic testing and next-generation sequencing when needed. Genomic testing helps to determine risk level, and next-generation sequencing can sometimes allow us to find certain targeted mutations that might imply that there are certain targeted treatments, and next-generation sequencing, which can identify certain mutations in the tumor that can open up options for targeted therapy. So to find out if specialized biomarker testing is right for you and your cancer, the first step is to contact our cancer center and schedule an appointment with one of our oncologists. You can either self-refer or have your current oncologist refer you. It would be helpful to ensure that all your previous records are sent to one of us for a review, and we would thoroughly review your case, including pathology reports, any diagnostic imaging that was done, and any other biomarker testing that had already been completed to then determine if further testing is right for you, and if so, what type. Sometimes when we do certain biomarker testing, such as next-generation sequencing, we uncover, as I mentioned, certain targeted mutations. In addition to having FDA-approved medications to target some of these, we also have clinical trials that are exploring the efficacy, safety, and benefit of certain targeted therapies according to your biomarker testing. One such study that our cancer center has to offer is the ANAVO 122 trial. This trial is for patients who have HER2 positive metastatic or stage 4 breast cancer and are candidates for first-line therapy with a taxane combined with dual HER2 targeted therapy. Patients are tested for a certain marker called PIK3CA, and if they carry that mutation, and if they meet the other criteria of the trial, they are then randomized to receive placebo with the dual HER2 targeted therapy versus the novel PIK3CA inhibitor inavolisib in combination with dual HER2 targeted therapy. And this occurs after the induction phase of their chemotherapy and HER2 targeted therapy when they have gone on to maintenance phase.
Thank you. That is all really important information. Knowing that you can ask questions and that it is your choice and what treatment is best for you is incredibly important. Next, we would like to welcome Dr. Reva Bashow. She is a breast medical oncologist and a clinical investigator at Ellison Clinic. She also serves as a chief medical officer at Ellison Medical Institute. Thank you for joining us. Can you tell us about your role working with clinical trials and how biomarker testing can help patients?
Hello, everybody. I'm Dr. Reva Basho at the Ellison Clinic at Providence St. John's. I am a breast medical oncologist and a clinical trialist. That means that I conduct clinical trials for patients to give access to new treatments. I focus my care and my research on breast cancer, and I'm very delighted to be here today to talk about breast cancer care and clinical trials.
Patient outcomes and quality of life should always be top of mind when we are talking about cancer treatments. So thank you, Dr. Bashow. We would like to introduce Anna Roche. Anna Roche is a nurse practitioner in breast medical oncology at the Ellison Clinic at St. John's. With more than 20 years of nursing experience, including 8 as a nurse practitioner, Anna has dedicated her career to supporting individuals after a diagnosis of cancer. Early in her nursing journey, she learned that cancer survivorship is more than just living through cancer, but thriving beyond it. As an advanced oncology certified nurse practitioner, Anna is passionate about empowering, teaching, advocating, and compassionately caring for patients and their loved ones. She believes in treating the whole person and values collaboration across multidisciplinary specialties such as nutrition, physical therapy, social work, research, and genetics to provide truly comprehensive care. Anna is also active in community outreach, providing Spanish language education to Latinx community on cancer awareness, prevention, and wellness. Outside of work, she enjoys spending time in nature, exploring art and culture, and spending time with her favorite people, plus her dog, Sarah, and her cat, Lucy, both who believe that they're people too. Thank you so much for being here today.
Hello, everyone. My name is Anna Rocha, and I am a nurse practitioner. I've been a registered nurse for the last 20 years, all 20 in oncology, and for the last 8 years, I've been a nurse practitioner. I've had the honor of working with Dr. Reva Basho for the last 3 years, and am excited to talk with you today. Biomarker testing is a standard part of personalized breast cancer care. It usually starts with a tissue or blood sample, which is analyzed to identify biomarkers and any specific gene mutations or molecular features that could guide treatment. Patients can have this testing ordered directly by their oncologist or as part of the screening process for a clinical trial. Our research and molecular diagnostic teams coordinate closely so results are reviewed quickly and the right treatment or trial option can be considered without any delay. Patients can access clinical trials in several ways. Most often, their oncologist refers them when they identify a study that may be a good fit based on their situation. Once we find a potential match, our research team, including Dr. Basho, myself, and our research coordinator, reviews the eligibility criteria to make sure it's a good fit. Explain the goals of the study to the patient and their family, discusses alternative therapies off clinical trials, potential side effects, the schedule of events on the trial, and answers any questions that the patient or family may have. If the patient decides to move forward, we begin by obtaining informed consent and guide them step by step through the clinical trial process. We're with them every step of the way. We have witnessed and understand that a diagnosis of cancer can be life-changing. Contemplating treatment options and evaluating a clinical trial can feel overwhelming at first. That's why our team provides personalized support from start to finish, including education, financial counseling, social work, and other assistance to meet the needs of each unique patient and their family. Patients can reach out directly to our clinical research office at 310-272-7640 or speak with their oncologist to learn more about which trials are open and what support is available to make participation as smooth as possible so that there are no barriers to access the most current and promising treatment available today.
Can you explain your role in conducting clinical trials and share a little bit more about how patients can join a clinical trial at your site?
As the principal investigator, or the PI, of clinical trials at our site, I oversee the overall conduct of the clinical trial. It is my role to ensure that the study is carried out ethically, safely, and according to scientific and regulatory standards. When I meet patients, I consider which trials might be the best fit for each patient based on their cancer type, prior treatments, and biomarker results. When I discuss a potential clinical trial with patients and families, I educate them about the study, the potential benefits and side effects, and the alternatives. I oversee every step of the care patients get on a clinical trial to make sure it is in the best interest of the patient to continue on the study.
As a nurse practitioner, I play a key role in helping to coordinate and manage patients' care while they're on a clinical trial. I educate patients about the study protocol, help obtain informed consent, manage side effects, and monitor overall health throughout the trial. My goal is to ensure every patient feels supported, informed, cared for, and empowered through every step of their journey. If a patient is interested in participating in a clinical trial at our site, they can call 310-272-7640.
Thank you. Managing side effects and overall health in a trial are very important to patient care. I mentioned earlier that I have the PIK3CA mutation and I've participated in 4 clinical trials. Research and medical advancements are the only way that we are going to improve the survivorship and health outcomes of many women living with breast cancer. Knowing that there's more research taking place investigating the PIK3CA mutation, it really makes me feel hopeful. Dr. Basho, can you explain the INAVO 122 study to our viewers?
The INAVO 122 trial is an exciting global study that's evaluating a new targeted therapy called inavolisib in combination with Phesgo, which is a subcutaneous injection of pertuzumab and trastuzumab, as maintenance therapy for patients with previously untreated HER2-positive advanced breast cancer with a PIK3CA mutation. Inavolisib, or Itovebi, is a mutant-selective, alpha-specific inhibitor of the PI3 kinase enzyme. It is currently FDA approved for the treatment of patients with endocrine-resistant, hormone receptor-positive, HER2-negative advanced breast cancer. The goal of this trial, INAVO 122, is to see whether adding inavolisib can help patients with HER2-positive advanced breast cancer harboring PIK3CA mutation live longer without their disease progressing compared to standard therapy alone. It represents an important step forward in precision medicine, and we're hopeful it will lead to even better outcomes for patients with HER2-positive metastatic breast cancer.
In closing today's webinar, what else would you like to share about your team at Allison Center at St. John's?
We are both extremely passionate about the care of our breast cancer patients and about clinical research. If we can help in any way, you can reach us Monday through Friday at the Allison Clinic at Providence St. John's. We are here to help.
I want you to feel empowered to ask about clinical trials as part of your care discussion. I hope the information you received today has been helpful. Every question matters, and your curiosity helps us to find better treatments for future patients too. Together, we can explore all the options, standard treatments, and research opportunities. Each clinical trial represents hope. Hope for better treatments, better outcomes, and a future without breast cancer.
Thank you for joining our webinar today. We hope that you take this information and share it. Share it with your community. The more that we have these conversations with our families, our friends, our community, and with medical providers, the more informed and empowered that we can be as patients. Tigerlily would also like to thank the webinar sponsor, Roche. And for more information about clinical trial sites nearby, biomarker testing, or anything else that we discussed on today's webinar, please visit the Tigerlily Foundation's Choice website page. Hi, I'm Megan O'Neill. I am a 10-year and 2-time breast cancer survivor living in Los Angeles. I'm also an angel advocate through the Tigerlily Foundation. I understand firsthand how overwhelming it can be to feel like you're making good decisions for yourself with your own cancer care, and how overwhelming it can be, and how sometimes it feels like you don't have a choice. And Tigerlily Foundation, we want to remind you that you do. We want to empower you to learn more about your disease. We want to empower you to learn about things like clinical trials and genetics and biomarkers.